Hello, I'm Stacy Lindsay, the CEO of the Cholangiocarcinoma Foundation. Today, I'm happy to introduce you to the newly updated International Cholangiocarcinoma Patient Registry. This global secure registry will collect your de-identified health data and allow you the opportunity to partner with us to accelerate research, to improve diagnosis and early detection, and advance therapies. In addition, you will have a place to safely store all of your medical records. If you need a second opinion or you want to share your health records with family members, it makes this very easy. The patient registry is free to join and your privacy is completely protected. I'm now going to turn the time over to Connor O'Brien of Invitae to give you an overview of what you can expect when you participate. Thank you.
Thank you, Stacy. I really appreciate the introduction. My name is Connor O'Brien, and I am the Oncology Partnership Manager for Ciitizen, part of the Invitae data platform. Over the past year, it has been my incredible pleasure to work with the Cholangiocarcinoma Foundation. Invitae and the CCF partnership exists for one reason: to accelerate and advance cholangiocarcinoma research and to fight back against this monstrous disease. This mission has been the bedrock of our partnership and is what has brought us all here today. CCF has been Ciitizen's oldest partner. Ciitizen was born 5 years ago with one singular vision: to help our users gather their health data and transform that data into a form that helps patients, drives insights for the research community, and breaks down the silos that plague the healthcare industry. And above all, it completes our most basic dream, which is to empower patients to own all of their health data. This is why today I'm so proud to discuss the launch of the International Cholangiocarcinoma Patient Registry. This registry is the culmination of years of work between CCF and Ciitizen. ICPR will finally give our shared community the power to bring together cholangiocarcinoma experts from industry, academia, and our patient community to drive research and keep going towards our ultimate goal: to find a cure. I encourage all patients to join the registry. Every single patient matters. Each one of you has the opportunity to help drive research forward and make a difference. And please know, if you are a caregiver, you can also register your loved ones to participate. And also, if you're a previous registrant, we encourage you to update your information following the link on the landing page. Together, all of our shared work can help make a difference for cholangiocarcinoma and build a new future for our patient community. Thank you very much, and I appreciate all of you listening to me.
Thanks, Connor. This is Jennifer Weaver. I am the Director of Communications, and I will actually be walking you through the webpage on the cholangiocarcinoma.org website, where you can find how to register for the patient registry. So you can see I'm sharing my screen right now, and you'll see the homepage. What you'll want to do is you'll want to click on the Patients tab. There will be a drop-down menu. From here, you'll want to go to Join the Patient Registry. Once you click on this tab, it will take you to a page that will introduce you to the International Cholangiocarcinoma Patient Registry and also give you opportunities to learn more about the benefits that you'll receive by your participation, which is free of cost to you. Some of the benefits that you can find out about is by clicking on each one of these green boxes, and it will enlarge to where you can actually see and learn more about your participation and the benefits you'll receive. You'll also learn that when you upload your records, you'll be able to share them with anyone of your choosing. You can also join the patient registry for your loved ones who have since passed. This enables us to empower global research. From here on the website, you'll also be given instructions. When you click on Register Now, you will basically put in your name and your email address, where you will consent to join with a new profile with Invitae Ciitizen. You'll confirm your diagnosis and upload your photo ID. It's actually just that simple. Once you've registered, every month the Cholangiocarcinoma Foundation will be doing a drawing. You'll be eligible for a free iPad mini. In fact, if you actually join today or within the next 2 weeks, by June 24th, 11:59 p.m. Mountain Standard Time, you will be eligible to enter that drawing. So you have 2 weeks to get that benefit. And if this is still a little bit overwhelming for you, know that every 9th of every month will be Patient Day. This day will enable you to get one-on-one assistance through the onboarding process, which now I'm going to actually be turning the time over to Mequel Bunch of Invitae Ciitizen, who will help you through the onboarding process once you get to Citizen, which actually looks like this when you click on Register Now. Thank you for your time, and let's turn the time over now to Mikael.
Hi, my name is Mikael. I am part of the support team here at Ciitizen, and today I'm going to demonstrate our onboarding process. You will need a couple things for the onboarding process. You will need a photo of your ID, either your driver's license or passport, and also your cell phone. If you don't have a cell phone, our support team is able to help you get through the process without your cell phone, but if you have one, please have it with you. So right now I am on the Cholangiocarcinoma Citizen landing page, and I'm going to click Join Today or Join Now. And we start off asking for the name. So we'll put first name in and then last name and choose Next. Next, you'll put in your email address. And then under the password box, you're actually creating your own password. It has to be at least 8 characters long, at least 1 uppercase character, 1 lowercase character, and 1 number. And as you hit these parameters, you'll see the green check marks populate to know that you've hit that parameter. And you'll click Create Account. It asks for whom are we getting records, either myself or a loved one. I'm going to choose myself and next. It asks for your primary diagnosis. So as you start to type your diagnosis, you'll see a drop down appear with different diagnoses, and you should find yours there and you'll be able to choose it. And next. It asks what year you were diagnosed. We will ask for medical records from the year of your diagnosis. Facilities are only required to hold medical records for 7 to 10 years, but many facilities do hold them longer. So we will attempt to get all of your records from diagnosis forward. I'll choose Next. It asks if your physician diagnosed you with advanced or metastatic disease. Yes, no, or I don't know. And then Next. It asks if you were diagnosed in the United States. I'm going to choose yes. Next. Now you will put in where you were diagnosed. This is either the facility name or a physician name. After you type in the name that you're looking for, you can click the magnifying glass, and that facility will show up, usually with multiple addresses if there are multiple facilities with the same name. Just be careful to choose the facility that you were actually seen at. It will confirm that this is actually where you were diagnosed. You can choose yes or go back if you need to choose a different one. I'll click yes. Next, it asks if you received treatment at this facility. So many patients are diagnosed at one facility and receive treatment at a different facility. So if you choose no, you'll be able to put in a second facility right now. When you are completely finished with the onboarding process, you will be able to put in as many providers as you need. So if you've been seen by multiple providers, at the very end of this, I'll show you how to put in as many providers as you'd like to request from. So I'm going to say yes, that I did receive treatment where I was diagnosed. Next. It asks if you would like to search for records at other healthcare institutions where you receive care. You can choose yes or no. It asks if there are any sensitive records that you do not want retrieved, either mental health, sexual health, substance abuse, or HIV. If you do not feel comfortable with us obtaining these types of records, just put a check mark where you do not want records received. If you are comfortable with us obtaining the entire record set, you can leave it all blank and choose next. This next page is asking if you would like to donate your records to research. When they are donated de-identified. Your personal information is removed before they're donated. You can actually click and look at the consent if you'd like. You can choose yes, no, or ask me later. Next. So the next page is where we are going to upload a photo of your ID. This is just giving you information about why we are asking for this information. I'm going to choose next. So we have some parameters in place to make sure that we are keeping your health information safe. One of them is we are going to text you a 4-digit code to your cell phone. And you'll put that in here. So I'm going to enter my cell phone number and continue. And I've received a 4-digit code texted to me. And I'll click continue. It asks what country my ID is from. I'm going to leave it at United States, select. It asks if you're going to upload your passport or driver's license. I'm going to upload my driver's license. If you have a photo of your ID, both your front and back of your driver's license or the front of your passport on the device that you're working on, you can choose to upload a photo right from the device you're working on. Right now I'm on my desktop and I actually want to flip over to my cell phone so I can take a photo during the process. So I don't need to have it already saved on my device. So I'm going to choose to continue on another device. And I'm going to send myself an SMS message. That's a text message that will come right to my cell phone. So again, it asks for my cell phone number. And I'm going to click send secure link. So if I look at my cell phone, I have now received a secure link that will bring me to a process of taking a photo of my driver's license. So I'll click on the link in my text message. Again, it asks me if I'm going to upload my passport or driver's license. I'm going to again choose my driver's license. And you have two choices. One of them is a blue box with a camera in the middle. If you click on that blue box with the camera, it'll activate the camera on your phone and you'll be able to take the photo. The other choice is to upload a photo. So if you again have your ID saved on your device, you can click upload a photo and upload it from there. I'm going to click on the camera, so it activates the camera on my device. And I'm taking a photo of the front of my driver's license. It asks if I want to use the photo or retake the photo. You'll want to make sure that it's clear and not blurry and that you're taking it in good lighting. I'm going to choose to use photo. And next it asks me for the back of my driver's license. So again, I click on the camera in the blue box to activate the camera. And I take a photo of the back of the license. And it asks if I want to use photo or retake. I'm going to click use photo. And now it gives me uploading with 3 bars. While this is uploading, I am going to show you a couple of quick things here. If you can see on my screen in the top right corner, there is an arrow in the shape of a circle. That's actually a restart button. So if you're in the middle of the process and you realize you entered something incorrectly, you can click on that restart button, which is the arrow in the shape of a circle, and that will bring you back to the beginning of the process. There's also a question mark in a side of a circle. If you click on that, that'll actually connect you to our support team, either via chat or with a phone number that you could call. We will be available to help you from 9 a.m. Eastern Standard Time to 5 p.m. Pacific Time. If it is outside of working hours and you type us a little message in that little chat box, we will actually respond to you the next day and you'll receive that response in your email. Okay, so once the ID is approved, it's actually going to take a selfie to make sure that you are a real person. So it says last step is to take a selfie and get started. It asks you to center yourself in the camera. It shows a head shape turning to one side and a head shape turning to the other side. And then it says verifying. All right. So the next step, it says, are there any prior names that your records may be found under? So if you had a different name when you were seen at these facilities, like a maiden name, or if it was ever a different name, you can choose yes and enter as many names as you need to, or no. Then next, it asks what number we should reach out to you with any questions we have about your record request. So I will put my phone number in here. Choose next. It asks if you would like to receive text messages from us. We don't text very often. We don't have any automated texts going out. This is only if we try to reach you by email and we're unable to reach you. We might send you a text, so you can choose either yes or no. And then next. So it pulls some information off of your driver's license. It pulls off your name, your date of birth, your address, your phone number, and it puts in the diagnosing provider. So if you need to make any changes, you can make them. If it looks good, you can choose looks good. Next, you need to sign in this little box here. It's a signature that the facilities use to verify that you are requesting your records. They compare that to what they have on file and to what is on your driver's license. So I know it's hard to do a good electronic signature, but if you could just do your best. If you are on a computer touchpad, you can actually click and hold down on your mouse or touchpad and sign that way. If it's a touch screen, you can sign that way. There is a little clear signature button. So if you want to start over again, you can clear signature and start over. Or once you have it as good as you think you're going to get it, then choose authorize. It just does one last check to make sure that we have everything we need. Choose next. And it tells you, well done, your records have been requested. When you choose next, it asks if there are any records that you would like to upload. You are able to upload any records in PDF format. You don't have to upload them right now. So if you want to upload them at a different time, you could log back in and upload them at any time. I'm going to choose no for now. So this is what your profile looks like once your records have been requested. To make additional record requests, there is a records tab up here in the right. If you click down, you can click request or upload. When you hit request, you're able to make as many record requests as you'd like. Records are not automatically updated. So if you go for new visits to your physicians or you have anything new that you want to capture at a provider, you can actually look at your list of providers and click view, and you can click update request. That will send a new record request going from the time of your first record request forward. And there's also a share feature in this top right corner. So if you want to share your medical records with any physicians for second opinions, for any loved one or caregivers, you're able to click that share button and share them by email or get a link to share them by link. So this is how your profile looks. Again, down in this bottom right corner, there's a circle with a smile at the bottom, and that is how you will reach our support team. So you can chat with us here at any time. And that's it. Thank you so much.
Hey everyone, thanks for being with us today. And it's my pleasure to be with you, giving you some background about our cholangiocarcinoma patient registry. So first, I would like to thank Jennifer and Ciitizen team for making my work easy by giving some introduction about the registry. And as we mentioned, that the value of this registry is that we are building a one centralized database to have all your medical records, in addition to some information about the disease risk factor, also some information about the family history, quality of life, So the first step, once you click on join the registry, you will need to like go through the process of requesting your medical records. And then once you submit this, you will get an email with the link that will be directing you to this page. And this is where you will be able to fill out the patient-reported survey. So the first step that you need to register. So we will go over now the process of registration together. Under the rule, you need to select your rule. So I will select a patient. So once you created your account, you will get this screen. And you need to first click on Join Registry. You will go through this consent form, which is actually explaining what is the value of the registration, who will have an access for your data, and you also give us the permission to share your de-identified information with the research community. And here I want to make sure that you understand that this will be a de-identified data. We will never share your name, emails, or phone numbers, or social security, any information which is personal, we will never share it. So once you go over it, if you are willing to participate, please go ahead and enter your name and the relationship, if you are like the patient, or if you are the caregiver, just enter this information here and then click on agree. So this is the first step. This is the patient profile. So based on the information that you will enter into the patient profile section, this will actually identify what is the subsequent surveys that you will get under your profile to fill out. For example, one of the questions here is asking about tobacco smoking. So if you select never smoked, so you will never get any questions or surveys asking about the details of smoking, like the amount of smoking and this stuff. And the same, if you select that you never had a high blood pressure, so you will never get any questions about the blood pressure treatment and the timing for or like the year of diagnosis of blood pressure and other questions. So I will fill out this patient survey with you so you can we can see together how what is actually the surveys that we build inside the registry. And all of these questions are mandatory, so please make sure to fill out all of these questions before, so you will be able to go to the next step. So once you save your patient profile, go ahead and click on next. And here is the surveys that you will, this is actually the maximum number of surveys that you will show up under your profile. So let's say if you have if you are a caregiver for a posthumous patient, under the patient profile section, you will have a question about how to, what was the date of death. And so you will never get a question about the patient health status, because this is actually the survey about quality of life, the current quality of life. So make sure to enter the information in the patient profile in an accurate way, so the subsequent survey that you will receive will match what you entered. The good thing that it's not mandatory for you to fill out all the surveys at one time. So you can, if you wanted to start with the birth history survey, just click on start. You need to answer these questions, and then scroll down, you need to save data. And once you save data, this test will show up that it's completed. And then you can return back later and complete all other surveys or any surveys. It depends on your time. Also, the good thing that once our team is able to gather all your medical records, the medical records will be linked to this account, so we'll be able to also access this through under your patient profile. And again, one of the tools that we have added to this platform, that you will be able to make a printout or download your survey response on a PDF, and you can share it with also your treating physician or your family member. So this is like really a summary about what is this survey, and on the website you will find our contact information. So please, if you have any issue in filling out the survey, or if you need any help, feel free to reach out to us, and we'll be happy to help you as we can. Thank you.
Thank you, Reham, and thanks to all of you who have joined us for this webinar on the updates of the patient registry. If you have not already joined us on Facebook, please head over there now, where you can pose your questions, and Connor O'Brien with Invitae Ciitizen will be happy to answer them. All you have to do is write your question in comments. Thanks again for joining us, and have a great day.
So we're going to stay on. Good afternoon, everyone. Thank you for joining us. We're now going to join live for the Q&A. So if you guys have questions about the webinar that was just shown, the webinar was pre-recorded, but we're happy to answer your questions live. And we are joined in person by Reham and Connor to answer those questions. And I see a few have come in. So Connor, if you're good, I'm going to read some questions to you, and maybe you can help me answer them.
Yeah, let's do it.
All right. So how do I know if I need to update my records? I enrolled in Ciitizen about 10 months ago, but I do not remember if all this ID information process, it sounds involved now. So is there anything different for patients who have previously enrolled in Ciitizen? What will they have to do? What are the steps?
Yeah, no, that's a great question. So just so you know, to join the registry, you do not have to update your records if you've previously joined, and we highly encourage you to still please really encourage you to complete the registry portion. However, at any time, if you want to go into your patient profile, and if you look up at the right-hand corner, you can request a record refresh, and that will begin the process of bringing in your new records. Not a requirement to join the registry, but you can do that at any time.
Okay, wonderful. And when you open the account, does it need to be the photo ID of a patient? What if the patient is deceased? What do they use for identification?
Yeah, no, another great question. So as you're working through our onboarding, there will be a section where they will ask if you're a caregiver looking to upload your loved one's records. And if you're posthumous, you will not need a government-issued photo ID. What they will ask you for is a certified death certificate. Those documents required will be laid out during onboarding. But no, you do not need a photo ID.
Okay, so along the same line, does the person setting up the account need to be legal next of kin to give permission to release medical records if patient is deceased? For example, does it have to be a patient's spouse, or can it be a son or daughter?
It can be a spouse, son, or daughter. Does not have to be the next in line. You just need to have access to those legal documents, which is the death certificate and that documentation.
Okay, so Reham, for all the patients who joined the patient registry that we've had on the Cholangiocarcinoma Foundation's website for the last 10 years, do they need to go back in and re-enter the information to the new surveys?
Yeah, sure. This is actually a great question. because we have a couple of patients like this, and they reached out to me before during the conference. And I definitely encourage every person to join, even those who participated before, because in this registry, the first thing, we added a couple of more questions about new risk factors, more details about the molecular profiling in this question, in this survey, and also more questions about the family history. The second thing that they will be also asking their medical record for their medical record. So we will be able to link both clinical information with the disease risk factor. So definitely go for it.
Does Ciitizen upload actual CT, MRI scans, or just the radiologist report, Connor?
Yeah, so for select studies, we will be doing DICOM imaging. Right now, all patients will get their radiology reports, and depending on the study, which will include a lot of CCF patients, we'll also be doing DICOM imaging. We don't do it all the time across the board for all patients, but it is something that we are able to collect.
Okay. So a question from Facebook. How do I log in to view my previously entered information? So I don't know if they're talking about previously entered information from our patient registry or from Ciitizen. So I'll let you both answer that question.
Well, I can take the first stab at it. So for Ciitizen, you'll have your login for information, and you can go in there and change at any time, add documents. If you have forgotten your password or username or any of that, we have a little button right there that you can request it, and we'll generate a new password and login information. So you shouldn't have to worry even if you use a different email address with a different documentation that you upload, we're able to match if you have a previously created account.
Okay, wonderful. Reham, again, what about the previous registry?
So we are currently actually working on integrating all the previous registry information, because in the previous registry, we have almost 1,600 patients participated. So we are integrating this with the current registry. So once it's ready, you will be able to show.
Okay, wonderful. So Connor, how is the data, and Reham for both sides of it, how is the data de-identified, and who is the data going to be shared with?
Yeah, excellent question. I can answer that on the system portion. So when your medical records come in, what we do is we don't hand those raw records over for research or anything of the sort. We have a whole team in pipeline where we extract the most critical pieces of data from those records. So let's say, different states of the disease condition, and we abstract those into one data file that we compare with others. Now that extracted data has all identifiers taken out. So any of your name or anything that you could be identified with, and that is what we will share within this registry for research purposes, but we'll never hand over any raw records or anything of that sort that has your identifying information. So it's all aggregated and with your personal information taken out.
And so, Reham, I'll let you answer the second half of that question, but Connor, real quick, can you touch a little bit, because I'm not sure it was covered on Mikael's portion of the patients actually consenting to share their data and how that happens?
Yeah, no, another great question. So when you begin Ciitizen onboarding, we have a general research consent question. Basically, we're just asking, are you willing to share only exclusively de-identified data for future research purposes? Now, the caveat to that is we'll always, if opportunities become available, we'll always ask you again, just to make, this is not in perpetuity. We'll always ask if you want to enroll. You own your data at all times, and that will never change. Now, for this specific registry, we'll ask that question up front, but then you'll also be asked to sign a very specific consent for this specific registry, and that will happen once you complete Ciitizen onboarding, and then you're brought over to complete the survey portion.
Okay, thanks. And then Reham, can you talk a little bit about who's going to be accessing this data and for what purposes?
Yeah, so only researcher like physician or scientists who are interested to study a certain question, they have to submit a proposal to our like the ICRN executive committee and the CCF team. So we'll be reviewing the application and make sure that this topic is interested for our patient and will be very helpful for them. So the researcher needs to submit the request through the patient registry platform. So they have a research icon. So once we get the proposal and we reviewed it, if it's confirmed that we will go ahead with this project, we will provide them an access, and the research access, this is a de-identified information. We exclude all the patient information, and each patient will have like a research code.
Okay, and Reham, can you also touch a little bit on why it's so important to have both the validated medical records and the patient-reported surveys, and how that can help to advance the research for cholangiocarcinoma?
Yeah, sure. So in the first thing that when we decided to move forward with merging the patient medical record with the survey, that the first thing we shorten maximally the survey. Initially, it was very long survey, a lot of questions about what is the type of cholangiocarcinoma, what specific molecular profiling that you have. Some patients actually don't know exactly what is this detailed information. So first thing, we got a lot of missing information. So we wanted to have a strong and completed as much as we can database to use for research. This is the first thing. The second thing, that think about what is the value of knowing that, okay, 60% of our patient has obesity, let's say. And if we don't have the clinical information about, and also the survival data of this patient, we will never know how this is like a risk factor or a protective factor for our patient. So we always need the demographics and the detailed disease risk factor with the clinical information and the survival to be able to build a logical research question and to get like a strong data for publication.
Could I say something about that as well? You know,
Please.
one, I just as a personal observation that I've seen in my role at Ciitizen, you know, historically, as a research community, there's been so much emphasis placed on clinical data and what we can do with that. And of course, like very important, helping drive different things forward. What has not always been, I don't want to say it's been looked down on, but what has not always been looked on with the same amount as validation, so to speak, has been patient-reported data. And the reason just being of, you know, there's sometimes been some questions. Can you trust patients to report accurately on their own disease conditions or therapies that they're on, their reaction to it? Now, my answer, very personal as a patient, has always been like, yes, many patients do know vast amount of information about their own patient journey, even if it's not, even if researchers look at it very differently. And one really amazing thing that we've been able to see is when we pair patient responses with their actual clinical data, we've been seeing a pretty high amount of validation that, oh yeah, patients do know what they're talking about. They do know the therapies that they're receiving. Their symptoms line up very much so with what we would expect. And it's been really, really fascinating to be able to prove that out with clinical data. So definitely, obviously, the research impact we have with those combined data sets is the primary purpose, but also kind of raising the level of saying, hey, patients do know what they're talking about. They are reporting accurate outcomes and reactions to different things. That's been a really interesting accomplishment of combining these two data sets.
Yeah, I agree. Patients do know what they're talking about. Okay, so my husband was diagnosed with metastatic bladder cancer in 2015, then metastatic cholangiocarcinoma in 2020. Do we register both the cancers for this?
Yeah, I can speak for the Ciitizen side. When you go in, you're going to register as primary as cholangiocarcinoma diagnosis. Now, however, we have many patients that have comorbidities and various cancers, and that will be listed in your data extraction. And that will be something that we can look at. You know, if I have a secondary cancer, whether it became, whether it was primary came first or after my initial diagnosis, those are data points we'll look like. For this purpose, we'll definitely just register under cholangiocarcinoma, but it's not, we will pick up the other condition within the records.
And I believe on the patient surveys, Reham might ask that medical history as well.
Yeah.
Okay. Next question. So do we supply the medical records, or are we just authorizing you to obtain the records from the medical facility? And then the next question is about someone living in Canada asking. So maybe we can hit those both on who does and who doesn't.
Yeah, no, great question. So for the first piece, so if you're living within the United States, we will support record collection. As you're going through onboarding, you'll list every institution that you've received care at, and then using the HIPAA right of access on your behalf, we will go out and collect those records from those institutions and bring them into your profile and do the data extraction from there. Now, on the international piece, for the time being, we still really encourage you to join the registry, especially for those survey responses. Now, right now, we can't support record collection outside of the United States for the reason being it's very different health data information systems, and it takes quite a while to get standing. However, that is a long-term goal of us that we will be expanding internationally. For the time being, you still can upload all your records into one secure digital location. However, just having your surveys responses attached and knowing that you're within the Ciitizen system, still very beneficial for the registry itself and contributing to research. And as more countries, international locations come online from our system to support data collection, we still may in the future be able to gather your clinical records as well. And Canada will be one of the primary first locations that we would go to.
Okay, and so is it fairly evident how to be able to scan and upload your own records, or is that something they should reach out to Mikael or someone for help with?
Yep. So if you go on and register right now and go into your profile, you'll see a button up in the right-hand corner that will have upload your own records. So whether it's scanned somewhere as a PDF or I believe you can also do direct photos and things of that nature. So it's pretty self-explanatory. However, if you ever have any questions, yes, please reach out to Mikael or myself, and we'll be happy to assist in getting those records in.
Okay. So here's a question. If requested, will you supply information to the Veterans Administration? Veterans are trying to get this cancer on the presumptive list of diseases caused by Agent Orange or the liver flukes. Can we use this data to do something like this? Reham, I'll let you go. I think.
So yeah, in the registry, actually, we have a couple of questions about specific for the veteran. So definitely this can be used, and a lot of like a question about the chemical risk factor and this stuff. And so yeah, sure.
So I guess that's my point I want to make. By collecting this data and getting that data and having the numbers with that data, then you can use that to take that data to the VA and show them that, look, this is these are the results we have, this, how many numbers we have. And I think it'll be a lot easier to prove that in hopes of getting it on the presumptive list for diseases. Yeah,
and I'll throw out one more thing, and Reham will definitely be has a perspective on partnering with the VA as a research partner. But I can just say this: I have spoken to a couple of congressional members about adding sarcomas, another rare cancer, as an Agent Orange or other chemical influence from both Vietnam and Iraq. And one of the proving points that was discussed around that is, when you see these different clumps, whether it be in families of diagnosed patients or in geographic areas, gathering that data is the type of things that they want to prove out that case. And that's what a registry like this is allowing us to do. Look at that different information, collect it, and make an argument that, hey, we're seeing a clump of rare cancers in this specific area or family with this experience. Now, I think there is a reasonable inference that we can make that there might have been a chemical component, whether it be through a grandfather that was exposed or directly. So that's the type of information we're trying to collect, and definitely facilitates making those arguments.
Thanks. I love that. That's so helpful. Okay, so their question was, is there a link to the register on the patient registry? And I believe that we just posted it in the chat. So the link is in the chat to go ahead and register. So when a patient goes to view their own records on Ciitizen, how is it organized? By date, doctor, facility type, etc.?
Yeah, it's a great question. So basically, there are two ways. When you have your initial, you'll have your records in and you can divvy up by institution. So for example, when you go into my profile, you'll see it broken down by the different systems I was seen through. However, what we do for patients after we have all records collected, which can take some time with multiple institutions, is we create what's called a disease summary, which you'll see in your profile. And basically, this will be a full longitudinal timeline of your entire care journey. So we begin with your additional diagnosis, where you'll be able to click into that link. You'll see the date of when that happened, and then we'll actually bring you to the actual direct document that we pulled that from, and we even highlight the paragraph. So my additional diagnosis, they have my biopsy pathology report, they have the diagnosis listed, and then you'll go down and we'll take you through basically all the different milestones within your patient journey. So we'll have any adverse events. So for example, mine has anytime I went inpatient for neutropenia, had my major surgery, radiation, and we break that all down in a timeline. So that is how it's broken down within the patient profile.
Okay. So do you have anyone that can review French medical records from Canada? And is there biobanking involved with the new registry? I don't know who wants to take that.
We do have French speakers on the team, but we do not right now support data extraction from French records. There's just the way our pipeline is built with the way things are coded, really geared around English. However, once again, other languages are top of mind. And I know we have a few people on the team where French is actually an area they're pushing very hard for. And for the second piece of the question, biobanking. So biobanking is something that we're definitely looking into for a number of rare cancers. This is not a portion of this specific project at this time, but it's definitely something that both our teams have an interest in, and we'll continue to look into and keep everyone updated.
Possibility for the future.
Exactly.
I just want to throw out to Evangeline, I see your questions, but I know that there's not going to be answers for those on here, but I just want you to know we're not ignoring you, and I'll reach out to you by email. Okay, let me see, we have a few more. So records would need to be in English outside of the US in order to upload them?
Not to upload them. You can upload in any language.
Okay.
For our extraction purposes, for adding clinical data to the actual registry data set, they would have to be in English. However, any records you have in any language, you can manually upload them into your profile.
Okay, wonderful. And there was a shout out to Mikael for being such a blessing on helping with all the support she gives.
Mikael couldn't make it today, but she is our rock star. Couldn't agree more.
How do people reach out to Mikael for help? Just email her, or I believe there's a chat button too, right?
Yeah, so there's a chat button and a support button on our website that will bring you directly to Mikael. You can also reach out to her at mikael.bunch@invitae.com. But if you go to the Ciitizen website, there is a support channel that will bring you to our team.
Okay, and again, can we just emphasize, if they already signed up with Ciitizen, do we need to update or create a new account?
No, all we need you to do is complete the registry portion. So no need to create a new account or update anything if you have already joined. And also highly encourage you to complete the registry if you are, even if you're already part of Ciitizen.
Okay, so curiosity, where does Ciitizen get its financial support?
Yeah, no, great question. So Ciitizen was founded about 4 years ago, and we're as a startup and came out as the San Francisco area. About 8 months ago, we were acquired by Invitae. So we are now part of the Invitae data platform. And it's actually been a really positive change as we've worked towards how do we integrate genetic and genomic data that's really critical for rare cancer research into the services that we already provide as far as clinical data. So we're part of Invitae. So the financial support of a public company. So that is that's how we've been structured for the past 8 months.
Okay, and I know this question always comes up to me, so let's just put this out there too.
Yeah.
The safety of patients' data.
Yeah, no, that's a fantastic question. So one of our co-founders was Devin McGraw, who co-wrote the HIPAA right of access law. Data privacy has been built in since our very founding. And one of our founding principles that you'll see on our site that's hammered into us as employees, as participants, and something that I asked about when I joined as a patient 2 years before I joined the team, patients own their data. We are a service that helps you collect those records and put them into a form that could support research purposes. However, you own it, and we will never share it for any engagement without your express permission. That's been built into Ciitizen when it was in a startup, and as the rules that we have kept in place after being acquired by Invitae, and it's something that we have buy-in for across the board. We have a page on our website that goes through all the different policies we have around data security, and we handle it very seriously. But at the highest level, just know you own your data. It will never be shared without your express permission. We work very hard, even when it is shared, to de-identify it and make sure it is shared in a limited format that's most useful for research, but maintains your security.
Okay. I think we have answered all the questions, but again, I want to emphasize, or maybe have you emphasize, Reham, the importance of having a large data set for cholangiocarcinoma instead of having all these small ones in different silos that researchers can't access, and why it's so important that they can go to one place and get this data, and it just makes it so much better, and it's going to move things along faster when they can do this. So if you have anything more either one of you want to touch on this, I would love to just emphasize that again.
Yeah, I want to make sure that this is not only beneficial for research, but is this also beneficial for patient? So having access to all your medical record under one profile that you can, by one click, share with your physician, share with your caregiver, make a printout, and at least you can get also a summary of your one part of this registry, that you will get a card summary. So you will be able to understand exactly what information you have. We are summarizing all your medical records in a couple of pages. So this is the first thing. This is very beneficial for patients. The second thing, that you are helping all researchers to move to do more research in this for this rare cancer, to identify what is the best treatment option, helping us design better clinical trial using the real world database. So this is beneficial for everyone, especially for a rare cancer like this.
All right, Connor, any last thoughts?
Yeah, I'll share from the highest level. I'm a cancer survivor as well. And when you look at the last 50 years of cancer research, sometimes it's easy to get a little bit despondent about it, so to speak. And especially when you look at rare cancer, they don't get the same amount of support nor attention. A big piece of changing that is making sure that we have big cohorts of data widely available and in egalitarian fashion that kind of breaks down the silos within healthcare. So what we've seen is, you have researchers or different institutions maybe interested in a specific rare disease, but it gets really stuck in one place with no developments. Efforts like these are a way for us to democratize large access to data and really push to move forward different therapies and research. And for cholangiocarcinoma specifically, we've seen a lot of developments in the past 5 years. I think there's a lot of reasons to be optimistic, making sure that the most robust data set with the most updated information, clinical, genetic, patient reported, so important as we encourage not only researchers to move in this space, but to actually bring new therapies to market that will change patients' lives. So that's why I'm here and I work on this. And I truly believe that efforts like this can make a difference, or else I wouldn't be doing it. So, and it wouldn't be possible without each and every patient that joins. So really encourage all of you to join if you haven't already. And if you know other patients in the community or families or friends, please share the information and encourage them to join. And every patient that joins will make a difference.
Yes. And as you are joining, if you have any feedback or suggestions or see anything, please reach out to us and give us your feedback, good or bad. We want to hear it both. We want to make this, a positive experience for everyone. So reach out to us with any questions, with any feedback. And I think Jennifer said, if you sign up for Ciitizen within the next 2 weeks, your name will be put into a drawing for an iPad mini. So thank you everyone for joining us. Thank you, Reham and Connor, for answering all the questions. And if you need us for anything, you can find us on the cholangiocarcinoma.org website. Everyone have a great day. Thank you.
Yeah, thank you, everybody.